Mike Waters, Timber Hill Athletic Club Health Promotion with you this morning. We're with Dean Johnson, acupuncturist, here at his office here in Corvallis. And this morning we're going to learn about the art and science and the health value of acupuncture. Good morning, Dean.
Hey, Mike. I'm Dean Johnson, Acupuncture Clinic at Corvallis. I've been doing this for 20 years. I practice acupuncture, which is Chinese medicine. It's been around for up to 5,000 years. Acupuncture itself is the insertion of little needles into acupuncture points or trigger points in the body, and it allows muscles to relax. It allows tendons to heal and get tighter. It works energetically in the body to stimulate various organs and such. Mostly what I do is acupuncture in the form of physical therapy, which is using needles and the trigger points and like I said, relaxing them, and it works quite well. It's sort of like a focused massage in a lot of ways, but with a massage you have to dig your thumb in, get deep in there, do a lot of bruising with the tissue. But with acupuncture you can get really deep without bruising the tissue. You can get a good stimulation. It works very nice, and patients are quite happy with it. Beyond that, acupuncture is just one tool of Chinese medicine. So we kind of look a little broader at patients when they come in. We wonder why they're not healing, for example. Why didn't this muscle heal? Why is there a knot in there still? So we'll look at things like posture or maybe even the diet and what the person's eating, because if they're not nourishing that muscle very well, then the muscle's not going to heal very well. It's not going to work too well. So we look broader than just as a physical therapy. We look at the entire being. It's a holistic medical system that's been around forever. And
You mentioned holistic, and or another term we've heard is called integrated medicine. How do you work with or integrate with other healthcare practitioners, even traditional Western medicine MDs? How do you work with them?
Well, we do different things, really. They send people to me sometimes, and sometimes I would send people to them. We're licensed by the Board of Medical Examiners, so we know a bit about what they do, and we're obligated to, when we check out a patient, if we see things that are warning signs of something bad, then we are obligated to send them to a medical doctor to get those things checked out. So we work in that respect. Is that clear?
Well, we know it works, and we know more. People are interested in it. And one thing I pay attention to is the health insurance systems, and I see that more and more are beginning to accept acupuncture as a treatment. They begin to reimburse for your services. Is that what you're finding in your practice?
Yeah, I don't accept insurance right now, but I do fill out forms for people, and I do have the super bill that we give people. It has the correct numbers in there, the correct code keys that you need for to be accepted by insurance. But yeah, more and more are accepted. It's sort of a no-brainer. It's inexpensive. It helps people. So yeah, a lot more insurance coverage.
Okay, well, why don't we do a demo? I know you wanted to show us a little bit about how this works and everything. Why don't we go ahead and do that now?
Okay, Randy, you want to be a pincushion?
Yeah.
So Randy's, can I talk about you, Randy?
Yes.
So Randy's had a neck issue going on here, so I know a lot about what's going on with him, so I can almost put these needles in with my eyes closed. But for a normal patient, I'd be poking around. They'd be telling me where their problem is. I can usually feel a lot. I've learned to palpate quite well, and I can find where things are stuck. much like a massage therapist does. But first we use the alcohol, of course, to keep things sterile. The needles, I have a number of various sizes of needles for different conditions. And the needles are just these little wires, if you've not seen them before. They come with a tube. The tube keeps the wire from bending when it goes in. And I find the spot, put the tube over the spot, tap it in, remove the tube, move it in a little bit, get a little bit of ache. I felt the muscle jump a little bit there, so I know I got it. Sometimes I'll ask the patient if they felt it. I tell them if you hit a nerve or something, like on the skin, which occasionally happens, I tell the patient to yell at me and I'll take the needle out right away. If you
Dean, some questions I get about this, people have a fear of, they think they're going to bleed or something like that. Can you explain a little bit why that doesn't happen?
Well, they're very thin needles. They're not like hypodermic needles at all. They're very thin. They're not hollow. A hypodermic needle is hollow. It's like a tube that's been cut off at an angle, so it's actually got a sharp blade when it goes in. That's why it hurts so much. And this is a needle that's been formed into a sharp point. Now, you might get a little pain if it hits a nerve ending, because when you tap it in, you can't see these nerve endings. Bleeding, when you take it out, you might get a little bit of blood. I'd say about 1 in 20 needles gets a little bit of blood, but it's not, it's gone right away. So I don't worry about bleeding at all. If you run some kind of medicine, I might be a little more careful. But even so, they don't seem to, like people that are on warfarin or something, or blood thinners, they don't seem to bleed any more with acupuncture than a regular person. So these points are actually all on the charts. We're taught where the most common points are, the trigger points. And they respond. They're points that are like tendons and muscles and in the West here we call it trigger point therapy, where we know about these points that are in the muscles that are duplicatable. Where people tend to get pain and such, and they tend to be the same things as the acupuncture points. The Chinese put them together into kind of a system of channels and collaterals, they call it, or meridians, as a way to try to understand how it all worked. And that can be useful sometimes, because acupuncture can be more than just muscles. It can be like liver problems. I treat liver problems a lot with acupuncture, and even though there's not a muscle involved, there's a lot of good points that will stimulate the liver and help it heal.
And when I hear the term creating a better energy flow, what does that mean in context of this?
Well, the Chinese have this idea that all pain, all dysfunction in the body is due to problems with the energy, whether it's flowing or being blocked in places, whether you have enough energy. Those are like the 3 different conditions that you could have: not enough, not flowing, not being blocked. And all pain is a blockage of energy. So the way they look at it, if you can unblock the energy, you can get rid of the pain. It's a simple model, but it works quite well in practice. It's a good way to look at things. Having enough energy is very important, because if a person comes in as weak, has low energy, acupuncture probably won't work on them or work. So depending on what they have, I may send them away with some herbs or some supplements and have them get stronger first before we do the acupuncture. Because when you're stronger, then you have more energy to move, and then the needles can do their work. So there's kind of two things we do. We build the energy and we move the energy. Move it with needles, and build it with supplements.
What about allergies? I've read, I'm studying about this, is sometimes you work with people that maybe have a allergy to the environment or a food allergy, anything like that?
I do work with allergies, and people get some benefit. It's not the greatest from what I see. People need to change their lifestyles. I'm sorry to say. Like foods, we need to stop eating bad foods, and we need to. But you can do. There's definite studies that show that it helps. It's not the thing I brag about the most because it's not so obvious. The people that I've helped with allergies, they have to come pretty often and to get the benefit. But they do get benefit for sure.
Now, your patient here has had the needles in there for a few minutes. How long is a normal treatment?
It usually takes me. I schedule people to come in for about an hour, and usually the first part of that is some talking. Where's the pain? How's it going with it? And what makes it better? What makes it worse? All sorts of questions about that. Then I check a couple interesting things about Chinese medicine. The diagnosis. I check the pulse. I check the tongue, and I do palpation on the organs to see what they feel like, so I can tell things about what kind of imbalance is going on in the body. So I do all that, usually at first, and then I'll do usually needles, like I usually do both sides. I'll do the belly and do the liver and such to try to clear that out. Most people in America have liver issues going on. And then I'll leave them in for maybe 15 minutes or so, and turn the person over, then maybe work on their back, depending again on problems that they have, and leave them in 15 minutes. And then I might, if there's time left, I do other things too. I do a massage called Bowen therapy, or NST, which I do on a lot of people. But is a good thing. In terms of Chinese medicine, be opening up a lot of channels. That's a nice thing. I have a lot of techniques I've studied over the years, and I bring them into play if they're needed for things. Kind of my specialty is the musculoskeletal stuff, so I've studied a lot of different things that are useful with that.
Now do you see a wide variety of patients, meaning anybody from just general to what we'll call a recreational athlete? And are there different techniques you use and things you see based on these different populations?
I see a wide variety of people, and different techniques depending on. I'm trying to think of an example. I treat a lot of OSU football player types, and big muscles, heavy guys. What do I do different? I need longer needles. That's one thing for them. They're very interested in getting it fixed quicker, which is one thing I'm pretty good at. Beyond these are just the simple needles. These work pretty well for Randy. Actually, I don't think I've had to do electroacupuncture on you. Have I, Randy? I don't think so.
Yeah, it's an electro. Yeah.
Oh, okay. But I do thicker needles, and I do this electroacupuncture that can really break through an area and get healing done quicker with a lot of people. Sometimes it's too much for some people. So some people I have all these different needles over here. Some people are very tender, and I have to go with really thin needles and not many of them, like frail people and such. But with like a real football player or something, I don't have to worry about that.
Our patient today is Randy Huber, and Randy's been kind enough to allow us to film him and allow me to answer some questions. So Randy, I know you've been doing treatment with Dean for a while.
Yep.
What can you share? What's been some of the issues, and how has acupuncture helped you?
Yeah, I'm trying to think what year it was, 19, or not 19, 2004, 2005. I had severe stenosis in my neck, and I was given some options, and one of them they wanted to do was surgery to go in and open up the facets and get rid of some of that narrowing of the facets and the stenosis. And the other option was to try acupuncture. And so my medical doctor suggested that I give acupuncture a try. And so that's where I started. And to this day, I ended up getting, well, I got about four treatments, and it pretty much cleared it up. It took me a couple of treatments, and I really started noticing quite a bit less pain and no issues. And after about 4 treatments, it was great. And since then, I've aggravated it a few times, and I go back for a couple of treatments of acupuncture, and it's worked great. So it's kept me out of the knife, and it's solved my pain issues, and it's been great for me. So I'm very happy with it.
So do you come back periodically for just like a tune-up, or?
Yeah, I do it once or twice a year. Just get one, and just I don't have any. I do it more often if I have issues, and sometimes, like I said, if I've aggravated it. But generally, yeah, just to go in and kind of it's a feel good. It just relaxes the muscles, and you come out feeling better. Well, it works great for me, and Dean's done a great job. And we talk about questions and health issues and things of that sort. And so it's you're not just put on a carousel and going through it, but we talk about life changes, and like you mentioned before, he's talking about diet and stress and all those sort of things that kind of add to problems. So
Excellent, thank you.
welcome.
What is there like an average number of treatments for the average person, or is it just really going to vary on the individual?
It varies so much. I usually tell people give it 3 tries, and if you're not getting better at all, maybe we're barking up the wrong tree. Sometimes I get it in the first treatment. I've got a lot of one treatment wonders that come in and gotten fixed in one treatment. But mostly I tell people, first treatment, sometimes it won't work at all even. You have to come and get another one, and then there'll often be a certain amount of improvement. But give it 3 treatments. If it's not changing, then maybe not the right approach. But it's usually a linear improvement after that. If you've gotten some improvement, like you get 20% after 1 treatment, it's maybe 5 treatments to get up to 100%. So it's so maybe nothing at first, then a linear improvement until it tapers off, and hopefully that taper off is at the level of 100% where you want to be. If it's not, then we have to maybe change the plan, or maybe it's not going to do everything we need it to do. But I haven't seen a better therapy actually for muscles and such. Better, quicker.
Excellent. Well, thank you for your time. We'll on our website, the video, we'll have the information how to make an appointment to see you, and if people have any more questions, they can call in, or they can look at your website and get more information. So thank you for your time.
Well, thank you, Mike.